Hi, I'm Dr. Mike DiTolla, and I'd like to welcome you to the Monet Clinician Spotlight. We are in the office of Dr. Sean Hamilton in Taylorsville, Utah. Sean, how are you doing today?
Good. How you doing?
I'm doing great. You've got a beautiful office. You've got 12 operatories in here. When I walked in, it was just busy as a beehive, so it's nice to see that you guys are staying busy and you do lots of comprehensive procedures. But I wanted to talk to you today about the Monet curing laser. I know that you've had some experience with it. When you were originally introduced to it, what was the thing about it that kind of got your interest?
Probably the potential for speeding up, making me more efficient, and speeding up being able to do procedures chairside.
Yeah, because most of us as dentists, I don't know if you're like this too, but we all seem like we cure 2 to 3 times as much as the manufacturer recommends. So whether it's 40-second cures back in the day or 20-second cures, it seems like we're doing it 2, 3, and 4 times. So the potential of a 1-second cure, at least if you're doing it, 200, 300% more, it's still just, 2 or 3 seconds. Is that how you're utilizing it? Do you find yourself using it for multiple 1-second cures?
Yes, that's probably how I use it the most. I mean, honestly, I was very skeptical at first about the 1-second cure, and it took several patients to trust it.
I was skeptical too when I heard about it for the first time, because when I graduated, it took 40 seconds to cure a composite. And so I think the easiest way, like at a dental show, if a dentist squirts out like 2 millimeters of composite and then cures it for 1 second and then turns the composite over and checks it with the Explorer and sees that it's hard, then they kind of can trust a little more that it's actually going to work in 1 second. But you're right, it's got to be something where you're like, this seems too good to be true. This feels like it's going to be too fast. There's been a big move towards bulk fill composites. Are you more of a bulk fill person, or were you trained like me? Were you doing like 2 millimeter increments?
I usually more like increments for operative procedures, just so I can make sure I assure an accurate cure, and I just trust it more.
Yeah, it helps. You know that it's cured all the way, to the base of the preparation, and you're not getting as much shrinkage necessarily as if you bulk filled it. So you're placing increments and then doing 1-second cures for each of those increments?
Yes, usually sometimes 2 to 3 second cures, but for the bonding, we just do 1 second because we don't want to overheat any bulk, the
Right.
pulp and the nerve. And then if we have any bases, or like an ultra dent, we use sometimes there's products, but we'll do that for 1 second as well. But any composite increment, 2 to 3 seconds, I usually at a 1 second interval, and that's
right.
So
yeah, and that's great, and there's nothing wrong with that. It's if you want to do 3, 4, 5 seconds in those 1 second increments, it's fine. You don't have any issues, and it's just whatever makes you feel more confident when using the light. How many of the Monet curing lasers do you currently own?
in the office we have 8.
You have 8.
Yeah, so
I think that might be the record. I feel like I should be presenting you with an oversized check as the winner of who has the most. But you've got 12 operatories here, and you've got, I saw that you practice with your dad, and both of you will work out of multiple operatories. And so when I came in, there was probably 7 or 8 operatories filled. So you never know. So you just have one basically in almost every room?
Yes. Yeah. It's like, a curing light, you use it like your handpiece or your suction.
Yeah.
Almost on every procedure you do, you can. So
it feels like it between operative dentistry and between crowns where we're using resin cements. It really is nice to have a curing light, and it doesn't make a lot of sense where, especially with 12 operatories, you would have your assistant having to walk to another room to go get one.
Correct. Yeah, it speeds up our time and makes us more efficient.
And you want to try to be as efficient as possible.
Yeah, for sure.
So when you compare it to the LED light that you had before, what are the biggest differences that you see compared to what you were doing with the LED light? Is it just that time and how fast it is compared to the LED light?
Yeah, the time. It does definitely. There's a little bit of a learning curve at first, but it speeds up your time. The design's really nice. It's nice in cylinder, but also the head is not very big, and so compared to, it's not as bulky. so it's easier access to fit into hard areas like the buckle number 15 or
Right.
things like that. So
I don't know if you've ever used the apertures, but it comes with these little snap-on apertures where there's like a 2 millimeter, a 4 millimeter, 6 millimeter hole. And when I got out of dental school and we were doing veneers, we would put the veneers on with the cement and put the 2 millimeter tip right in the middle of the veneer and spot cure it there and then clean up around the edge. I don't know if that's a technique that you've used, and have you ever used that 2 millimeter aperture on the Monet before?
not yet.
Okay. I just threw it out to see if
But
you had or not.
that would be really convenient. Usually we just cure in when I'm trying to do a 2-second, like on a veneer.
Yeah.
I just
Like a
hold it and then
tack and
pop.
wave?
Yeah, tack and wave.
And so tack and wave worked really well with halogen lights, and it worked well with LEDs where you could, or just do like a second cure here and a second cure there. The Monet's so fast though, it will be cured, with a second cure. And so there really is no tack and wave. So if you want to do tack and wave with the Monet, it's got the snap-on attenuator that cuts the laser output by 50%. And so you can put the attenuator on. That's the one that's got that kind of smoky lens in it.
Yeah.
And then you can do the tack and wave if you prefer to do that. Or if it's a restoration like a veneer, you can use that 2 millimeter aperture and then cure it right in the middle and then clean up around the edges like that.
Oh, that's great.
So overall, you've had a very positive response to the Monet and would recommend it to your colleagues who asked.
Yes, it's very efficient. It's fun. It has a little, and that has a little guiding laser you can see.
Right.
But patients seem to really enjoy it because they don't have to hold their mouth up as open. But,
Exactly.
One application I'm just sitting here talking to you and thinking about is with children.
Yeah.
So with pediatric patients, especially like a sealant, it really speeds up your time, and so it's less time you have to worry about isolation.
Yeah.
And
that's a great addition because you're on the clock when you're working on kids. And I noticed when I came into your reception area, there's a tiny little reception area for the kids to go into. And you have, instead of a toy box, this huge oversized like gumball machine with toys in it that our videographer actually wanted to break into, and I had to pull him back from that. So you guys obviously see a decent amount of kids here at the practice.
Yeah, we do. And we've had no complaints about the laser last time. But
and getting in and out is of the essence with kids.
Right, especially with so it really helps with the isolation. And I know there's lots of products like Isolite and rubber dams and things, but still it helps you be in and out almost like they don't even know you're there. So.
Yeah, that's a great point because really we have, the other dentists that we've talked to probably aren't doing as much pedo as you are, and so haven't mentioned that before. So that's actually a really good point. And I guess it stands to reason that you have 8 of them, so you're probably pretty happy with the product. So thank you, Sean, for letting come into your office today and sharing some opinions with us. I really appreciate it.
Thank you. It was nice to meet you in person.
All right, thanks.